right. Well, good afternoon, everyone, and welcome to today's webinar entitled Innovative Approaches to Sharing Data Findings with Funders, Policymakers, and Community Groups. My name is Dr. Dana Hunter. I'm the Research Portfolio Manager with Arizona State University's Office of Community Health, Engagement, and Resiliency, and also an investigator on the CDC CCR project, which I'll share that acronym in just a minute. We here at ASU, we are a 2110 CCR recipient, along with Washington State University Partnership, or WASEP as we call them. Our team is led by Dr. Mary Ellen Brown, who serves as the Director of OCHR and Principal Investigator, or PI, on the CCR initiative. Along with Dr. Brown and myself, we are so proud of our team of several other highly skilled professionals, staff and professionals that we partner with and work very closely with to achieve the mission of the CCR project. And so from all of us today, we want to say welcome and bring you greetings and just thank you for taking time out of your busy schedules to join this webinar. Before we begin today, please know that today's webinar is being recorded. We would also like for you to know that we have interpretation throughout the duration of the webinar. Today, we're pleased to have with us again our two interpreters, Maria Pape and Natalia Rivera. They've been with us before, so we're pleased to have them again. I'd also like to share instructions on how to engage in the English or Spanish channel if you're interested. On the bottom of the menu in the Zoom window, there's a globe icon that says interpretation. Click on that icon and select your preferred language. Also, a friendly reminder to our speakers to speak slowly and clearly, giving Natalia and Maria time to interpret. Next slide, please. All right, so now we will go ahead and get the ball rolling, get our show on the road. Thank you all again, and Happy New Year and all of the above. I can't believe we are already a few weeks into the new year, but time is rolling and we're excited to continue in this project. All right, we want to thank you again for being with us. Today's webinar, as I mentioned before, is a part of the Community Health Workers for COVID Response and Resilient Communities, or CCR as we like to call it, program. CCR is a CDC initiative launched in 2021 to support the training and deployment of community health workers to strengthen community resilience and address health disparities to fight COVID-19. And as always, we want to take just a minute and thank the CDC for allowing us to serve as evaluation partners on this project. If anyone would like more information about the CCR program, you can click on the link provided in the chat box to find more information. Next slide, please. Now I have the esteemed honor of introducing today's speakers, Dr. Craig LeCroy and Maria Velasco. Dr. LeCroy is a professor of social work at Arizona State University, where he has taught for over 20 years. So we are excited to have his expertise with us today. He also holds an appointment at the University of Arizona in the John and Doris Norton School of Family and Consumer Sciences, Family Studies, and Human Development Division, and a clinical professor appointment at the University of Arizona Department of Pediatrics. Dr. LeCroy is co-founder of LeCroy and Milligan Associates. Craig serves as the Director of Research and Evaluation and Principal Investigator on numerous research projects. So again, Craig, thank you for being with us today. And Maria Velasco. Maria Velasco is a community health worker who resides in Tucson, Arizona as a community health advisor with 25 years of experience working at El Rio Community Health Center. She's been a frontline worker that modeled her work from the late patient advocate Julia Soto, and from her experience as a health educator in HIV/AIDS prevention. Maria has accomplished so much to impact the community health worker field. She formed part of the ADHS advisory board that worked on advising on volunteer certification for CHWs. She continues to use her passion and skills as a CHW to create change and to advocate for health equity, human rights, and social justice, which ties into her role at the Pima County CHW Coalition to build individual and community capacity. So Maria, thank you so much for taking time to share your expertise with us today. Before we hear from our presenters, I'd like to turn it over to my colleague, Zoe Somerville, who will review today's webinar goal and objectives, share the agenda for today, read ASU's land acknowledgement statement, and share a few important updates. So Zoe, I'll turn it over to you.
Hello, everyone. My name is Zoe Somerville, and I'm a research analyst with ASU's Office of Community Health, Engagement, and Resiliency. So the goal of today's webinar is to equip CCR sites with the knowledge to display data in innovative ways. Our objectives are to learn how to develop and utilize pie charts, graphs, and infographics, strategies to share data with historically marginalized communities in meaningful ways, and to learn about methods for presenting data to various audiences that produce insights for CHWs and other stakeholders. Here we go. So this is our agenda for today. We're going to be split between Dr. LeCroy will go ahead and present first, focusing on the intro to graphs and charts, and then communicating, interpreting, analyzing data. And then we'll give you an opportunity to ask questions for Dr. LeCroy. Then we'll move into Maria Velasco's presentation, which will focus on community engagement and communicating data to the community and why that's important. And then we'll have space to have a Q&A with Maria as well. So I'm going to go ahead and read the land acknowledgement for Arizona State University. So ASU's Office of Community Health, Engagement, and Resiliency acknowledges the 22 Native nations that have inhabited this land for centuries. Arizona State University's 4 campuses are located in the Salt River Valley on ancestral territories of indigenous peoples, including the Acamel O'odham and Peeposh Indian communities, whose care and keeping of these lands allow us to be here today. Some notes, please stick around for information about upcoming webinars at the end of today's presentation. At that time, I'll go ahead and share registration links in the chat. Lastly, please remember that AMP is where you will find information about the CCR project and where you can make TA requests for assistance with your project's evaluation, including follow-up on any of the topics we talk about today. This webinar will be uploaded to AMP as well as YouTube, and I will send those links out when they're uploaded. Last thing here, our code of care for today. You are welcome to introduce yourself in the chat and share what organization you are working with. Please remember to mute your computer if you are not speaking. Feel free to use the Q&A box for questions. You can write these down throughout the webinar. We'll be monitoring the Q&A box, and we'll reserve time at the end of the session to address any questions. Please use the chat feature in a respectful manner. Please list your Zoom name as you would like to be referenced. Feel free to take care of yourself. If you need to take a break or step away from your camera for any reason, feel free to do so. And like I said, this webinar, along with all handouts we share, will be uploaded onto AMP at a later date. So with that, I will go ahead and hand it over to Dr. LeCroy.
Great, thank you, Zoe. Yeah, so today I want to talk to you about presenting data in graphs and charts. And so we're really going to just focus on how can we unlock the power of data visualization. And I'm going to provide, this is a comprehensive guide, that's kind of stretching the truth, maybe an introductory guide to presenting data in graphs, because we have a short amount of time and there's entire classes on this topic, okay? So the objectives really are to understand the purpose of chart graphs and charts, kind of just give you an introduction to that, learn some of the components of graphs and charts. What are they made of? How are they presented? And look at some of the different types. I want to give you some examples and leave you with a template that might be helpful. So, there are various types of graphs and charts, but the most common are line graphs, where you're really plotting data values over time to display trends and patterns in data. So, for example, the most common line graphs you're familiar with are probably graphs that show how things are changing over time from 1 month to 2 months to 3 months to 4 months. There's also bar charts. They compare and contrast numerical values across categories. So you want to use bar charts when you're trying to show quickly these big contrasts. So for example, a common bar chart might be of ethnicity, where you could compare your population on ethnic characteristics. Or pie charts. And so we use a pie chart to illustrate proportions and percentages of a whole. This is typically done when, of course, you have a whole that represents 100%, and then you can easily show how you can divide up that whole and what it makes. And so it provides a really quick glance for what is included in that particular pie chart. So, for example, if you did one on gender, it could show the percentage of male, female, non-binary participants in your program as one example. Okay. So to understand data visualization, I think the first thing is really the power of visuals. So I hope at the end of today's short presentation, you come away realizing that visual representations of data are very powerful and can be used way more effectively than they typically are. To make them really powerful, we want to keep them simple, and we want to try to take complex data and present it in a way that can facilitate understanding. I think in today's world, data speaks very loudly. And I think in the last 10 years, people have recognized that people present too much data. People are overwhelmed with data. And what resonates with people is a visual representation of what the data means. And so in my field, for example, program evaluation, many people now are trying to utilize better data visualizations. It's really a hot topic that we talk a lot about, try to figure out how to present that message and make it as powerful as possible. The other way you have to build on that is with storytelling with data. Data is just data, and too often people just present data and they don't have a narrative and they don't have a way to engage and captivate their audience by telling the story of what the data represents. So this is very important, and you can make a much more compelling presentation and information about data. So for example, a colleague of mine who writes a lot about poverty is a very big data person. He statistically analyzes all sorts of data that's very complex. He always includes narratives. So even though he's presenting this data, then he's telling the story of a family that's in poverty that helps people think about how the data really relates to their personal lives. And then perception and interpretation. All data has different perceptions and interpretations to it. So it's important for people to recognize that there is a psychology behind we perceive and interpret visual information. And recently, with a lot of the research on decision making and how people make decisions, we've come to recognize that people interpret data in ways that we didn't really quite realize before. So one good dramatic example might be this. We know from doing research if you were going to go to your medical doctor and have a medical procedure, the doctor could say to you, well, 10% of the time this surgery fails, but 90% of the time it's effective. That usually turns people away, and then they're not as interested in having the surgery. If the doctor instead said, well, 90% of the time the surgery is very successful, and 10% of the time we find some difficulties, completely changes how people interpret the data. The data obviously is exactly the same, but the way it's presented leads people to interpret it in a different manner. So that's why interpretation is really important. Okay. So the design principles are straightforward here for effective graphs and charts. Simplicity, keeping your visualizations clean and uncluttered for maximum impact. And I work with a lot of program evaluators. My staff, I'm still working endlessly to get them to simplify all of their information. They write big reports, long reports, complicated reports. How can we make it more simple? What is the key message you're trying to communicate? How can we keep this visualization to its bare bones so that it's easier for people to understand? Consistency. If you really want to do a good presentation, you have to work on consistency and presentation. And that includes even things as simple as color palette, typography, what's the font size and how the fonts are laid out, and how the whole thing comes together. That's going to make the most effective presentation. People that get paid a lot of money spend a lot of time and effort in creating this beautiful, consistent presentation. So there's a lot to learn, and that's always a high standard to strive towards. And then accessibility. We want to have our presentations as accessible as possible. So we want to make sure that they're simple and that viewers can, even viewers with visual impairments and other kinds of impairments, can access the information as much as possible. Okay. Now, what are some common mistakes to avoid? Well, the first is data overload. Avoid overwhelming your audience with excessive data points. This is important. I think that we are always working on trying to figure out how to reduce data overload. Right now, I'm working with one of my staff people, and they're writing a comprehensive annual report, and it's pages and pages and pages long. And I'm working with the staff person to say, okay, this is too much information. How can we minimize the amount of information? Let's focus on what's important. How do we do that? We have a couple of strategies, and we're going to go over a little bit today. But one, for example, is what's the key information we want? And then all the detail that they want, we put that in the appendix. Put that all in the appendix. And so people have access to all the detailed information, but we can concentrate on the message we're trying to deliver and not overwhelm people with data. Inaccurate visual representations. So we want to present data in a way that accurately reflects the values being communicated. So, I think there's ongoing lessons about truth in data, and I think social media has convinced us that we can get a lot of inaccurate visual representations. All the more reason for us to try to figure out how to make sure that we present this in an accurate fashion, because data can be presented in a very misleading fashion. You can change what's on the X and the Y axis in a way that makes, for example, something look like a big difference, or in reality, it's a small difference. So there's a lot to be said about really being accurate with your data. And then lack of context. So data is just data, but what really helps people is understanding the context of what's going on when you're presenting the information. So if you're trying to explain something, you're trying to present data about a social problem, it's important to provide as much context as possible. What's the background? How is the data gathered? What are all the different things that are going to help aid people in interpreting this information? Because there's a lot to interpret and think about. And we present these big reports with a lot of information. We don't help people think about what the data means and help them get the value out of what we're doing. Those are things that we really have to improve to increase the quality of our ability to use data and present it effectively. Okay. So interpreting and analyzing data from charts, from graphs and charts. So how do you do this? Well, the most simple thing are these three aspects. So let's talk about each one. One is to identify patterns. So here you're uncovering meaningful insights by analyzing data, and most of the time you're looking for trends in the data. And that can be very helpful to you to look at just simple trends and patterns in the data. So what we look at a lot, for example, because we do outcome evaluation, is we look at trends over time. So how did the person, where were they at the beginning of the program, 3 months into the program, 6 months into the program? Can we show that they were getting better, or is there a story to be told about them not improving or even potentially getting worse? Or we can look at patterns, across any of the different kinds of variables, as long as you're trying to line it up and see what is the pattern telling you. So in annual reports, for example, when we've done these for a number of years, the patterns are often looking at patterns over yearly time periods. So in the last 3 years, we're going to have 3 years of data. We're writing a current report. We might be able to make comments about how this changed from last year. So you can imagine this, right? In our last annual report, in many of our evaluations, COVID happened, and so we were able to comment and show how COVID affected the patterns in the data, and then that provides the context for explaining those patterns as much as possible. Okay, then drawing comparisons. Here we're just looking, kind of creating narratives to captivate the audience and help them think about what the different comparisons are. So we have to always be thinking about what are some interesting comparisons that could be made. Yesterday we were analyzing some data from some research projects that we're doing, and my data analyst was savvy enough to recognize that there were real differences in some of the data between the Latino population and the white population. And so that cued us into providing more comparisons between how these subpopulations were differing with regard to the outcomes. So there's a lot of different ways to do this. Another example would be in one report where we were looking at the client population was young teenagers and young adults all the way through middle-aged adults, and we were able to look at a comparison between engagement of the young adults compared to the middle adults, and then it became very clear that the young adults and the teens were not engaging with the program. This has very clear implications then for trying to think about the data. Why is that? What can be done from a programmatic point of view to increase engagement, since we knew that wasn't working because we made that comparison? And then with all of this, it's really about critically evaluating it. So again, you want to have the data, but you want to be able to think about the data. And I think too often we don't think enough about the data. We've been doing a lot of needs assessments in our community and other communities. We just finished one with Cochise County. And the important, so we present all this information, there's a lot of data in it. And now it's really up to the program people to critically evaluate the data. What are they learning that's unique in their community that's going to help them think about how to deliver better health services? They have to critically evaluate it in order to get the most out of it. So, okay. Now, and so just again, to make this point about how you can interpret data in different ways, I have a little short video for you.
Here's one I like, how marriages end. There's two ways marriages end, really. There's divorce, 44%, and then there's death, 55%. Those are the two ways marriages end, folks. If people always say, oh, divorce would be horrible, well, look at the alternative. It's death. Divorce isn't so scary when you think about the alternative. And then there's actually 1% that is faking your own death. Very small. This is the percentage of Americans who are overweight for their height. 65% of Americans are overweight for their height. But look at this. This is actually 65% of Americans are actually just not tall enough for their weight. It's all relative, if you ask me. I'm not overweight. I'm 3 inches too short. I'm going to Height Watchers. I'm going to look good in about 2 inches. Here's one. 1 out of 10 people suffer from hemorrhoids. Does that mean that 9 out of 10 people actually enjoy hemorrhoids? Ooh, the itching, the burning. I love this time of year. I can't sit down. Let's go dancing. Here's one I like. How marriage.
Okay, so that's maybe a funny way of thinking about how you can easily misinterpret the data. What does the data really mean? You can see you can bring some funny interpretations to it. So, what are some tips for presenting graphs and charts? Well, you have to know your data and understand your data thoroughly and confidently. So you got to spend some time really interpreting and thinking about your data. And you have to ask yourself very practical questions. Does this make sense intuitively? Because if it doesn't, then there's probably something awry. So an example might be, you might be presenting data on, let's say it's on income of the people participating in your program. And unbeknownst to you, Jeff Bezos, the owner of Amazon, answered that question. Well, since he's the world's richest person, that data is going to look not very accurate. And you're going to have to realize that you've got an outlier. So you're going to want to have to deal with that to figure out how to understand the data and make it presentable in a way that makes the most sense. Other ways that we do that, I don't want to get too technical, but oftentimes for us, we're looking at means and standard deviations and trying to understand, does this data accurately represent what's going on? But if you have your data and it doesn't make sense, then you might need to go back and look at it, because there's a big translation between getting your data, people entering the data being cleaned, and then using the data. So you got to really know your data. Highlighting key findings. This is, again, we've emphasized this. I'm going to emphasize it again. One of the most important things is to put these insights in front of your audience, make sure that they understand the key findings, the key takeaway messages, and then use annotations. You want to label and annotate your guide so you guide the audience through all these visualizations and they can understand the data. Okay. So then I just want to go over just a couple of quick examples to give it to you. Here's a slide that presents some data. But if you look at the slide, it's pretty compelling. 1 in 4 adults reported feeling lonely always, often, or some of the time. So that's a response to one item of data. And it has the dates there. And it has that graphic that shows 4 figures and 1 person highlighted. And now you can get a feeling for 1 in 4. 1 in 4, that's a lot. And as you probably know, it's accurate. I mean, we really have an epidemic of loneliness in our society now. And it's a mental health issue that we need to put more attention to. So if I was writing a report and I had some information about loneliness, I would try to contextualize that. So like, look, we're finding what a lot of other people are recognizing, which is that loneliness needs to be addressed because it's an important factor, okay? And then here's another slide that again tries to tell a message in an impactful way. If you look at this slide, look at the mood that it presents. Look at the color in the slide. Look at the person in the slide. Parents without paid sick days are 70% more likely to send a sick child to school. So if you're communicating the message, that's a powerful way to communicate that message. And you can see how they highlighted 70% more likely and sick child to school. What's interesting about this slide and the next slide, it came from the President's State of the Union address. So President Obama was the first president to include slides in his State of the State presentation, which is also kind of interesting because he's such a great speaker, but he recognized the power of the visualization. and present it in a dramatic way. Here's another slide from that presentation. And this says, it's time to give more Americans a shot by leveling the playing field. And so it shows the bottom 90% of income going down and the top 1% of income shares going up. And so again, he's trying to communicate this message that, you know, we need to tap into the top 1% of billionaires who have an additional money that can be shared across our society, because the people at the bottom need more support. And he makes, you know, he uses a nice line graph to tell a very dramatic and important story about that. Okay. So we talked a little bit about just, making sure you tell the message impactfully. This says, with the Affordable Care Act, I am a wife and mother to 2 young children, ages 6 and 10. I am recovering and alive because I had insurance. Now look at this slide. That tells it, you know, you could overlay that slide or present the slide before that could be the data about people who don't have health insurance. And now you're putting a human face to it. You're helping present that to a community of people so that it can resonate with the power and the importance of that message that's being delivered. And it's very personalized. The more you can personalize it, the more impactful it's going to be. Okay. So a couple of examples from some of the work we've been doing. So we're working with this project called Arizona Project Aware. It's funded by Access and the Department of Education through a big federal grant that's trying to promote mental health, wellness, and resiliency in school settings. And so this is what you call an infographic. And this is just a short, quick summary of what's been going on that tries to tell the big story. This, of course, is accompanied by a long evaluation report. But our clients love these infographics. And it says, what are the project highlights? Well, 5,120 mental health professionals and community members trained, 73,963 individuals engaged, 1,191 students accessing services. So you see, what are we doing? How is this money being spent? What's going on? And then it highlights the state team highlights, presents the state team highlights around capacity building, training, and outreach. And then it has the district highlights. There are 3 districts involved in this program. And it's got them listed below, and it shows some key pieces of information. Okay. So here's a template that you could use to think about presenting data and presenting an infographic. Who's participating? So you're collecting participant information. Almost all evaluations and data presentations start with like, who's involved? Who are you who's being reached? And that's such important information that it can tell you all sorts of really critical things. And again, just to emphasize how important it is to think about that information. So for example, I'm doing some work right now with Intermountain Mental Health Services, and we have new information on who's receiving their services. And now they can reflect on whether or not the people receiving the services, is that the population that is in most need? And if not, why not? Okay, so then what services are being delivered? Typically people want to know, well, what is the program all about? What's the delivery structure? If it's got a curriculum, how are they doing that? Are they implementing it effectively? What's being delivered? And then how much service is received? So how many clients are enrolled? How long do they stay with the program? What can we tell people about service delivery and engagement? Those 3 things are really important if you were to present some data about a program. Who's participating? What's being delivered? And how's the service being received? Okay, next slide. So here would be an example of that. Cognitive behavioral intervention for justice-involved individuals seeking employment. And so you can see this has a lot of data on it, and it tells a pretty complete story. It says, here's the target population with a description. Here's the program components. It's got core sessions and 11 supplemental sessions and a list of 5 topics that they emphasize. So you can immediately get a feel, okay, what are they doing? Okay, you get a feeling for that. Who's participating? And now it's got some graphics there that show who's participating, what services are being delivered. You know, you can see sessions delivered as scheduled, 82%, pretty good. And you can see that they actually do makeup sessions. That's interesting. That's presented right there in the chart. And then how much service is being received? Well, it says 66% of fathers received at least one one-to-one service. So that tells you something about the engagement of the program. And, you know, program evaluators and program staff have to think about if that's meeting their goals. We don't know what the program goals are. And then that last graph is a line graph. It's pretty dramatic. It says percentage of fathers who completed the sessions starts really high at 70%, drops all the way to 16%. So you can see that engagement is a significant programmatic issue, and this graph tells that story very completely. Okay. And that's it. And I don't know how our time is, but I can take some questions as needed.
Yeah, you are welcome to put your question in the Q&A. Oh, it looks like we got one. So I see a hand raised. Miss Irene, if you want to come off mute and ask your question. Unless I have to let you talk, in which case I'm looking for your name.
Okay, thank you. I do have a question for Dr. LeCroy. My question is on the info, the last ones, you call them the info datas. For me, and I was an educator at a high school for 20 years, middle school for 5. So when I present information, I try, like you say, try not to have it too cluttered or anything like that. For me, the info datas, they are harder to read. And explain to really look at certain things. I find it's too much to present. So can info sheets, would you suggest that they actually be separated, or are you trying to keep them info datas? Are you trying to keep them all together for presentation of certain groups, or can you lead more into that, please?
Sure. Good question, Irene. I think you know, it's tricky, right? It kind of depends on your audience and what the purpose is and how you're using this information. So for us, most of the time our infographics are for our clients where they just want a summary sheet of quick information. And they're pretty familiar with all the details in the bigger report, the more comprehensive report. But I think your point is well taken, which is there is a lot of data on that. And so it is a lot to consume. One suggestion I might have, Irene, is that if I were to present, for example, that last example of the cognitive behavioral treatment, I might talk to my audience first and tell them a little bit about what the key findings were and have them follow what I'm saying in my narrative. Then I might present that graphic and walk them through all of those different pieces so they could follow it a little bit more closely.
Thank you.
Perfect. And then I have a couple in the chat here. The first one is, thank you for this presentation and template. Are there examples of visualizing qualitative data or blending qualitative and quantitative visualizing? Yes,
lots of people are doing that, so I'd absolutely encourage you to do that. So even on an infographic, you could have, you know, a slide, or you might, so for example, if you were presenting data on the health, access to the Affordable Care Act, that one quote I read you might include that. You might just include that one quote and then present the data. So you could continuously use more qualitative and quantitative data. I think that's really important. And it's very important to do. People want to know how this information affects them personally. And if you're presenting to community groups, marginalized communities, members, they want to know that you understand their lived experience. So presenting the lived experience through quotes and qualitative data is really important. Lately, we've been doing a lot of work with Arizona Department of Health Services doing listening sessions because they want to really try to hear more directly from the people that are impacted by their services. And so, we try to integrate some of those quotes in the data as well. I mean, we have whole separate reports that just look at qualitative data, but I think integrating quotes and putting a human face on any piece of data is going to really help make it more impactful and help people understand the importance of it.
Perfect. Thank you. And the last one isn't a question, but it's a compliment. Thank you for your presentation, Dr. LeCroy. Appreciate the use of humor to distinguish different ways to present and interpret data.
Great. Yeah.
So if anyone else has a question for Dr. LeCroy, feel free to type it out now or raise your hand. If not, you're welcome to send them to me and I will make sure that they get to Dr. LeCroy.
Okay, that's a good place to end, Zoe. Data and report writing, it's fun. It can be interesting. So yeah, we have to keep all of the work that we do as entertaining as possible. And that's a really important point here today, is trying to really, really present information that people can use.
Perfect. Well, thank you so much.
Thank you, everybody.
All right. We will go ahead and go into Miss Maria Velasco's presentation.
Hello. Thank you for such wonderful information. And I hope to bring it to, how I apply, some of the skills and some of the ways that utilizing the data as a CVPR researcher and evaluator, as a community health worker, has worked for me. So greetings from Tucson. I'm Maria Velasco. And yes, as I said before, I get to actually work on the front lines in the clinic. So I'm embedded in the clinic with the providers, helping with the social determinants of health, a lot of times solving the problems. But with this presentation, I hope to share my experience in utilizing this techniques of research and evaluation, and how this has helped me illustrate the effectiveness of the work of community health workers through my work. In this slide, we see how during COVID-19, I actually just got really trying to find out a way to help our people. I worked at the El Pueblo El Rio, which was on the Irvington and South 6 area, the south side of Tucson. And I invited my colleagues and my friends to come and help me distribute masks. And this was Mother's Day of 2020. So the first slide picture shows you, it's actually Mayor Regina Romero and some of my colleagues from different organizations distributing masks. And here we're showing, how protected we are, and this fear because contact at that point, and all we had was masks and testing. So that highlights the collaboration work that was so important back then. I began before this actually, and I go back a little bit just to tell you how my beginnings were also in a pandemic, in the HIV and AIDS days, and we conducted a needs assessment. It was a randomized, so we had to go, every fourth door and ask a really in-depth questionnaire about sexual type questions and what type of needs there were in the west side of Tucson. I felt how important it was to be part of a health education and prevention movement at that time, because you could really feel the movement of non-judgmental work and how to, get ready for educating. And then I went on to work at that time I was getting my degree in at the bachelor's level, and I went on to actually get my life skills education that was in home economics at the time. So I began working after that directly in a patient advocate setting. It was before CHWs was the main term. Patient advocate was I actually preceded our first patient advocate. And then I started realizing, because we would go to conferences, that there was all this evaluation going on and all this work going on for the community health worker. And I got interested in that work at that time, but later on I got involved. So with the Community Action Board, and this is in the far corner, we have a picture of the Community Action Board. So next slide, please. So with this, I found that being part of this CBPR research team, with CBPR, I mean community-based participatory research, it allowed me to develop my skills and competencies in evaluation and research. And it was super important for me because it really was a way to validate the work that I was actually doing on the front lines. So I began with Links, is a project that it's a research. So what I'm describing is the work that we do alongside the AZPRC. It's a PRC is a CDC funded like school. University of Arizona gets the funding, and they launched into the CBPRs, the community-based participatory research. So this was in 2017, but it had started a couple years before. And then we transitioned to another round of funding at Unidos in 2020. The role that I played in that was recruiting, engaging in the research committee, and helping with the data, both qualitative and quantitative. And here I'm sharing for community health workers in the field and for community health workers allies is the actual it's what the competency looks like of participating in the evaluation and research. So we work on identifying priority issues, we evaluate research questions, we develop evaluation design and methods, we do data collection and interpretation, we share results and findings, and we engage with stakeholders to take action on these findings. This is a skill that, and a competency that I found really, really important to share with you today. Next slide. So in the evaluation and research skills, so the actual skills that I use are my ability to identify important concerns and conduct evaluation and research to better understand the root causes of things. So what's happening is, as a community health worker, we are actually always problem solving, always helping to determine what needs are the patient needing to address to be more effective with their healthcare. And so these are the root, these are the different skills that I apply. So my ability to apply these evidence-based practices, and in this case with the CBPR and participatory action research. So community-based participatory research was so important because it democratized research. It allowed us as community health workers to be part of the team. And I share the skills too. Next slide. Okay, here is actually one of the poster presentations that I shared with last year with El Rio has a poster presentation, and we did it virtual this last year. So I shared what it looks like so far with Unidos. So you got to remember that Unidos started in 2020. So we designed everything before the pandemic hit, and then the pandemic hit right as we launched into the actual on the ground portion of it. So the original objective of the Unidos intervention was to reduce chronic disease risk and enhance social support and social networks to improve the health status. And regarding the first objective, there was agreement that decreasing that chronic disease risk was still important, given its association with the increased COVID-19 morbidity and mortality. However, we as community partners recognize that participants were more in immediate need of finding more information, direct information, knowledge about COVID-19 and educating. And then we as community health workers had to help them navigate a lot of the technology issues and barriers that were happening. We also confronted the pressing socioeconomic challenges that were a lot of people were unaware of the resources that could assist them. And at that time, there were so many that actually came up, like mutual aid and different things that were very, very important. The collaborative discussions between the academic and community partners generated consensus that addressing participants' pandemic-related challenges could be achieved via the community clinical linkage model, and that's what I'm highlighting in the different graphs here, and the model that we designed, because we are a collaboration in the border region. So we have in Yuma, we have Nogales or Santa Cruz County, Pima County, and then Maricopa County. And regarding the second objective, the CAB Research Committee felt strongly that CHW facilitated social support was still a crucial component for this intervention due to the increased isolation experienced by community members. And I don't know if we have the sound for the slide, but if you want to, we can try it. My name is Maria Velasco. I'm a community health worker here at El Rio Community Health Center. We are part of the Unidos, which was created as a community-based participatory research alongside the University of Arizona AZPRC Center. We are part of a collaborative with Pima County Health Department and El Rio Community Health Center, Sunset Community Health Center, paired with Yuma County Health Department, Mariposa Community Health Center in Nogales, and Valle del Sol and Maricopa County Health Department. We found that using REDCap is both a data repository and an intake facilitation system, where I was able to utilize the REDCap as a way to interview and evaluate the health and wellness needs of the patients by using the assessments within the Unidos REDCap database. When I went to evaluate the social service needs, we used the Prepare that was embedded in the REDCap. It was also created as a dynamically populated resource list, where I was able to use the resource list to make real-time referrals based on participants' answers and the Prepare form. So the community health workers followed participants across 6 months, utilizing REDCap to assess patients' needs and make service referrals at each visit. We see some results that include having the community health workers make 107 housing-related resource referrals, 15 unemployment service referrals, 26 referrals to food-related resources, and 197 mental health service referrals using the social service information integrated into the Unidos REDCap database. You also have a snapshot of the participants, which at that time was 129 participants. 45% reported worrying about housing, 27% reported being unemployed, 16% reported having problems with food insecurity, and 82.6% reported having stress, of which 14.7% was very much. We found as a conclusion that the use of RIDCAP afforded community health centers increased capacity to better track SDOH referrals among the patients. And a recommendation is a more robust tracking system that should be implemented to follow patients' referrals more accurately. Thank you.
Thank you. Next slide. So here I just break out the original way that we discovered how important the community clinical linkage model, which was what we discovered in links. And I, definitely shared the resource so that you can go in depth and look at the different findings that we have. We were able to coordinate healthcare delivery, public health, and community-based activities, and we were able to promote healthier behaviors. One of the most important things was how we were able to form relationships between we call it a community health worker in the community and one in the clinic. So that relationship, it almost felt like I had more arms, more ways to help our community. And then this is the graph of the bridge that we are creating as community health workers. We also formed partnerships with the families and the community, and we found how important it was to involve them in the strategic planning and improvement of activities. Next slide. This is a slide in which I am describing more in depth how this community-based participatory research team engages with the community. We apply the principles of community engagement, and this exemplifies these principles. So we build on strength and resources within the community, which encompasses the border region, like I described the different ones. We empower resource sharing by collaborating with the design, dissemination of both the design of the intervention and then the design of the findings, the research findings. And then we really use mutual benefit relationships with our research as a key to how community health workers are not only the focus, but are part of all stages of the process. And the picture in the corner, well, I don't think you're seeing it, but it's just an opportunity that I had to share the knowledge with. It was a group of students that came to El Rio to talk about what it looks like on the ground. So as researchers, you don't want to just be looking at, the data. You want information from the public, from the ground level, from the public. So they came and we had a nice sharing moment with them. And next slide. So what I see important to share with you is the design process is an essential part of how your research can be adapted to look at different key people that are, well, because we're focusing specifically with CHWs, we actually are key in terms of how we set down. So with the Unidos, for instance, we're focusing on the social cultural resiliency model. And that is a model in which we are seeing how Latinos have more advantages in their healthcare needs because of the way that we as a culture have come together as families. Like, for instance, when you go to the hospital, you don't go alone. You go with, 5, 6 people. And we actually found that model would be so important to study. So as the Community Action Board, we sat down and actually designed Unidos with that in mind. Next slide. This is a very recent evaluation tool that I was able to guide our CHR, CHW, promotoras, and our allies through. And this was conducted at the Roots Conference. We have an annual conference with ASCHO, which is our Alliance of Community Health Workers. And we actually are seeing here what it looks like in terms of, I had 3 questions that I was asking, and the technique that we used was drawing, so art. So the CHRs are describing how they look, their resiliency, their cultural competency, their compassionate use of their skills, and the visibility and credibility. So it just shows you how to also use, a creative approach to evaluation. And then we are going to use this in a report that we'll have to see how, and I'll step back and tell you a little history of it. So we as a profession are barely at 1 year. At this point, we were celebrating our 1 year of being recognized as a profession. We were actually part of a bill that passed, and then we all became involved in creating the rule making, and finally it was launched in November 7th of 2022. And so we are evaluating the effect of that, the effect that having voluntary certification and what that means to us as community health workers. And we do that this way, and we do it with actual questionnaires that will bring us the data level as well. Next slide. Okay, so here we just have, some resources for you. So if you want to go more in depth with our findings, the AZPRC website would have the infographics. The C3 core competencies is where you can find all the competencies, skills, and then some incredible guides as to how to structure your community health worker interventions and your workforce. And then just some articles. And next slide. So in summary, this is a picture of actually our team of researchers at the Manning House. We were meeting quarterly at the Manning House. And it just shows that using research and evaluation tools to illustrate the story of community health workers is an effective tool that allows the profession to show how we are a cultural bridge, the navigators, the problem solvers, and the change agents. So I have my colleagues, Alma, Ada, which is the principal investigator, Abby Lohr, who was our coordinator, and the late Conchita Somoza, who was a promotora in Nogales, and Marta Ochoa, myself, and Cynthia Espinosa from Yuma, that were part of the Links team. Thank you so much. This is just, a community activity where we're sharing stories in Anita, Barrio Anita. And I want to say thank you very much. If you have any questions, please.
I apologize. I meant to put another Q&A slide, but if you would like to unmute and raise your hand and ask a question, or you're welcome to put it in the chat. So we'll leave a little space for that. Ryan Smith says, great presentation. Shout out to the CHWs. Miss Irene Carbajal, it says, thank you for sharing your story. Okay, so thank you very much, Maria, for the great presentation. We use REDCap to track our service referrals and to track clients' social determinants of health. Could you please share your experience with REDCap as a referral and tracking platform?
Sure. So REDCap is a great tool. I think it guides you through all the different, we were using the different scales to measure different things. So you used it as a formal data collection, but then we found that embedding the actual resource list. So when you're doing the prepare, you're asking, for instance, food insecurity questions. And, when you identify that somebody does have food insecurity, you're able to link to the resources. And that was a really important finding. And Unidos is in the last stretch right now. So we'll be, actually doing all the research findings and all that. But in my own experience, that tool was just amazing to be able to just, navigate immediately. And then it was always being populated with new resources. So yeah, I would suggest REDCap, and I think the Prepare actually is an important tool because it also is designed to capture data as well. I just can't wait till we can use the data to solve the issues, the social issues that are so big now.
Awesome. Thank you, Maria. One last call if anybody has any questions or comments. Again, you are welcome. I'll be sending like a follow-up email. If you have any questions for Maria, you're welcome to send them my way, or she also has her email on the slide there if you wanted to reach out directly. But again, thank you, Maria, for presenting today. It was great to hear your expertise. And it'll be exciting to see the findings once you have them. So we'll just wrap up here today. So special thanks to ASU OCHR's, to ASU OCHR, directed by Dr. Mary Ellen Brown, and CDC, CCR staff and partners for their support and assistance with promotions and marketing, and then each of our speakers and staff members who assisted with making today's webinar possible. So upcoming webinars, Envision will be hosting Sustainability Summit info sessions. So that will, the info sessions will include guidance on selecting summit attendees and introduce you to the communities of practice leading up to the summit. And then they'll share details about the registration process, insights into what to anticipate during your time there. The same information will be presented in both sessions, so you only need to attend one. And then let me go ahead and put this link in the chat here. If I can get it. The registration link will be in the chat. If I can get to the right place, then I will go ahead and put that there. And then there is a on-demand webinar. So WSEP and ASU created an on-demand evaluation webinar resource focused on equitable participatory evaluation. So it is available in AMP if you have access to that. It's also available on YouTube if you don't. I'll go ahead and put those links in the chat as well. It's about 15 minutes. And so it'll be used to guide the evaluation community of practice for CCR. The video and alongside the PDF handout of the graphic itself can be found in AMP and is meant to spark reflection and action on how we might embed more equity into our evaluation process. So that is here. Again, this presentation was supported by the Cooperative Agreement funded by the Centers for Disease Control and Prevention. Its contents are solely the responsibility of the presenters and do not necessarily represent the official views of the Centers for Disease Control and Prevention or the Department of Health and Human Services. Remaining questions and feedback, you're going to see a short survey pop up on your screen. Please take a moment to answer the assessment questions to let us know how you enjoyed today's webinar. Additionally, you may send any remaining questions or comments to Dana Hunter or Dr. Mary Ellen Brown. Let's see, and I believe that is it. So thank you everyone who oh, link 1 had an error, link 2 accessible. Okay, let me fix that. But again, thank you everyone for being here today. And Dana, if you have any last thoughts.
No, thank you, Zoe. And thank you, Zoe, for just facilitating. And again, we just want to thank our speakers and thank all of you again for taking time to join us. And I hope it was beneficial to you. And again, thank our speakers. But thank you all. Have a wonderful day.